While it's commonly accepted that prostate cancer occurs more frequently in men in their 70s, a recent study shows that younger men are being diagnosed at an increasing rate. While doctors continue to investigate the reason behind that phenomenon, our next guest, Dr. Anup Vora of Chesapeake Urology, has adopted new techniques to not only screen for the disease, but also to treat it in a less invasive manner. Dr. Vora, welcome.
Thank you for having me.
So happy to have you here. So talk a little bit about your practice.
Sure. So I'm based out of Chesapeake Urology Associates. We're a large urology practice, not only in the state of Maryland, but we're expanding nationally as well. And we take prostate cancer very seriously. It affects too many men.
So talk about also some of the signs for prostate cancer, some of the early signs that we might not be aware of.
Of course. Prostate cancer is a cancer that generally is silent, and that's what's scary. Men with early stage prostate cancer won't know it. They won't have any symptoms, and often when they start to get symptoms, such as urinary dysfunction, it's too late. And 165,000 men are diagnosed with prostate cancer every year. Despite our advances in medical technology and treatments, 30,000 men die every year. And so we know there's more work that needs to be done, and we're very active within our practice to promote prostate cancer screening and just to make awareness.
And I think a lot of times people are concerned that if they get diagnosed with prostate cancer that they might lose sexual function. Is that always the case?
That's a great point. Prostate cancer, when it's diagnosed, patients commonly think about the side effects first, because the side effects can be quite devastating. They include loss of urinary control, so men can leak urine. But also men can lose sexual function as well, and that's very impactful to their relationships, to their families. And so it's of grave concern, but it's not always the case. There are newer treatments, and I'm here to talk about one of those newer treatments today that will allow cure of cancer, but less risk of those side effects.
That's what I was going to ask you about. It's called HIFU.
Correct.
And what is HIFU exactly?
Sure. So HIFU stands for high intensity focused ultrasound. So it's spelled HIFU.
Okay.
It's been around since the 1990s, 1995 to be exact. It was used in Europe for some time, and now it's FDA approved for use in the United States, and so we offer it to our patients now.
And what has been the result with offering it to your patients?
It's been excellent, and what it exactly is what we found is if we take a beam of ultrasound energy, and if we direct it at the prostate tissue, we can heat it almost to boiling and destroy the prostate. And if we aim it at an area where there's cancer, we can destroy the cancer, but also very precisely avoid those critical structures to preserve quality of life.
So this is a lot less invasive.
Absolutely. It's almost, if you think about it, the best of both worlds. We get to cure the cancer, but also preserve someone's quality of life, lower the risks of side effects. So it's a very good treatment option for patients, and we're very happy to now offer it.
Especially now that you're seeing this affect younger and younger people. Why do you think that that's the case?
That's a great question. Research is still ongoing. We know that men, and I've seen it every day, where young men come in and say, this is an old man's disease, but it's important to get screening. It's important to start the conversation early, and we can help diagnose more men with this disease.
Wonderful. Thank you so much, Dr. Vora. And they can go to ChesapeakeUrology.com. All that information was just on the screen. Appreciate you being here, and we'll be right back with more Midday Maryland right after this. Stay tuned.
Thank you.